Hi guys, Dr. Daniel here, and I wanted to just provide some clarification around the AstraZeneca vaccine after the bombshell that was dropped by the Prime Minister last night following the National Cabinet meeting. I won't get into the politics of everything, but as far as we understand it, he's made it quite clear that anyone under 40 can get the vaccine after they've had a discussion with their doctor. Now, that advice has not come from the Department of Health, nor has it come from Medicare or anything like that in terms of eligibility. But if the PM says that anyone can get it, then I guess the rules are there. Now, I want to clarify a few things because I think this is obviously left a lot of people confused as to why we could before, we couldn't, under 50s and over 60s, etc. Firstly, there has never been a ban on people under 60 getting the AstraZeneca vaccine. Globally, people have been receiving it over the age of 18. I think the advice in Australia had always changed because of the relative risk of developing a clot or the TTS syndrome, as described, the thrombocytopenia type reaction people could get with the vaccine. And that this risk seemed to be higher in younger people compared to the risk of actually catching COVID. Now, that's all changed in the last week because almost every state in Australia has cases of COVID now. There's lockdowns everywhere except for even South Australia has a bit of a lockdown, but probably the only place without COVID at the moment. So the risk profile has changed. The cost benefit, the risk benefit of this is different now. So firstly, there was never a ban. It was just advised that people over 60 get AstraZeneca because the risk of developing a clot from the AstraZeneca vaccine was much lower than both the risk of catching COVID and the catastrophic sort of sequelae or the consequences of developing a COVID-related illness were in that age group. But that changes. So I want everyone to look at their risk as personally and decide what they think is best for them. Secondly, the official rollout guidelines haven't changed. So technically speaking, only phases 1A, 1B, and 2A are eligible, which is people who are frontline health workers, people that work in the health-related industry, disability workers, people living with a disability or with an underlying medical condition, or people otherwise aged 40 and above. That's phase 1A, 1B, and 2A. But yesterday's announcement throws that out the window for a particular vaccine brand, which is AstraZeneca. Okay, so I'm going to take the Prime Minister at his word, and if people book in under the age of 40 and they understand the risks, we're happy to give you the vaccine here at Green Square Health. But I'm going to make a separate video about those risks, and I want you to watch that, understand that before you go ahead and make your booking. Thirdly, is about vaccine dose timing. Now, in Australia, the dose times between the first and the second dose of AstraZeneca was advised to be 12 weeks. Now, this came about for a few reasons. It initially started in the UK because they were running out of vaccines for the second doses. They were delaying the second dose. And then they found that people had a boosted immunity the longer you waited. We know that to be true with a lot of other vaccines as well, is that when your immunity starts to wane after a first dose, a second dose can help elicit more of a memory T cells to be activated and remember that you had this infection before. But the minimum time frame for giving this vaccine has always been 4 weeks. Even patients of ours who needed to travel overseas with exemptions or travel for health reasons were given the vaccine in 4 weeks' time. There might be a slightly reduced efficacy overall, but all those studies were done based on the initial variants and not the current variants that we have. The more pressing issue is that for things like the Delta variant of concern, which is taking the world by storm, is that you need to be fully immunized for it to be effective. A single dose of immunization is effective at reducing some infections and some severity, but nowhere near as good as it would be with 2 vaccines. So starting from today on our online booking service, we will reduce the time frame between first and second doses to 4 weeks, but we leave that in your hands as to when you would like that vaccine given. If you are completely isolating and the chances of you being exposed to someone with COVID is really low, then you can wait for 12 weeks to get your second booster and be fully immunized at a higher rate. If you want to reduce your chance of catching Delta, if the numbers keep rising, you can reduce that time to 4 weeks. Now, we are still limited by supply of AstraZeneca vaccine, but for the next few weeks, we can probably increase the number of doses we do every week. At the moment, we do 200. We might be able to increase that for a few weeks. If people who have a second vaccine dose coming up and it's been sort of more than 4 weeks but less than 12, you might be able to change your appointments. But it is based on appointment availability, and all these appointments are going to be done through our online booking provider. Fourthly, what is happening with the AstraZeneca vaccine does not change what is happening with the Pfizer vaccine clinics. So starting the 10th of July, Green Square Health will be running a Pfizer vaccine clinic on Saturdays. We're not making the appointments available yet because we want to make sure we have the vaccine, we have the staff, we have the booking systems in place before we open those floodgates. And we've still got a week and a half to do that. So please keep an eye out. Please do not call our receptionists. The guys at the front, they're not doctors. They will try their best to help you, but they unfortunately can't answer a lot of your questions. So I do encourage everyone to have a look at our website, read through the blog post, which I'll update today with everything that I've said here, and sign up to our email newsletter. I promise that I don't spam you. I write all the email newsletters, and I only write them when they're useful to our patients. Updates to vaccinations, updates to restrictions, ways to stay healthy during this lockdown, ways to utilize telehealth, things like electronic scripts, ways that make your life easier. And I don't send them more than once a week, once a fortnight. So please don't unsubscribe if you do want to hear useful information from me. But if you go to our website and go to the contact us section, there is a sign up form to our email newsletter, and I will update everybody when vaccines are available and the eligibility requirements through that newsletter. There'll be booking links directly as well. If you do want to get the Pfizer vaccine, then you can book through the New South Wales government vaccine clinics, the ones, for example, at Homebush or RPM Medical Centre. And if you go to the New South Wales Health website and go to the COVID section, there is a link to help make bookings there. I know it can be tricky getting an appointment time, especially if you're under 40, but check that out if you can't get it through us. So for us, we do have to follow the national eligibility criteria. So we'll be strictly limited to people who are in 1A, 1B, 2A. And unfortunately, we cannot give it to people age 60 and above. I think this is purely an availability thing. And looking at the horizons that they've talked about over the next 3 months, probably from September onwards, it will be enough Pfizer for everybody. But we are stuck in that situation now where there's not enough for everybody, and we need people to be vaccinated, and there seems to be enough AstraZeneca for everybody at the moment. So you guys make the call that's right for you, whether you are pro for doing this, whether you're worried about it, read the risks. I'll tell you the information as it comes to light. There's really no reason not to get the AstraZeneca vaccine, unless you've had a clot as a result from the AstraZeneca vaccine. It's pretty much the only contraindication at the moment. And maybe if you've had heparin-induced thrombocytopenia, it's a similar mechanism. But other than those, if you've had a DVT or a different kind of clot, there seems to be no contraindication to getting this vaccine unless you had an allergy to it before as well. So please look online to book online. Please don't call our clinic. I don't usually say don't call the clinic, but for the vaccines, please don't. We even have a message on the phone that runs for about 20 seconds saying if this is about vaccine, please don't call because they can't help you. But I think everyone's ignoring that today because everyone's a bit anxious. So, it'll be okay. We'll look after you. We'll get as much vaccination as the government will give us. We will deliver it as often and frequently as we can. And I'll keep you all up to date with everything I learn about. Okay. So thank you for paying attention. Check out the link below for the video on clot risks and how that might apply to you in June 2021.